Welcome to our deep dive today. We're going to be exploring puberty in girls.
Ooh.
From a medical textbook,
Okay.
which I know sounds a little dry,
Uh-huh.
but I promise you,
Yeah.
it's way more fascinating than you might think.
It really is. I think, we kind of take this whole process for granted.
Yeah.
But there's so much going on sort of behind the scenes.
Right.
It's really like this carefully choreographed dance, but with hormones.
Okay, I like that analogy.
Yeah.
So we all know
Mm.
that puberty is basically that transition from
Yeah.
childhood to adulthood.
Yes.
But what I find fascinating is that it's not just about becoming like sexually mature.
Right.
It's this whole process of actually reaching fertility.
Yes.
The textbook even uses the term Tanner stages
Okay.
to describe the physical changes that girls go through.
Yeah. Tanner stages are basically a way for doctors
Check.
to describe the different phases of physical development
Okay.
during puberty.
Yeah.
So they look at things like breast development, pubic hair growth, and other changes
Okay.
to kind of assess where a girl is in the whole process.
So it's not like one day you wake up and
Right.
boom, it's puberty.
It's a gradual unfold.
Yeah. So speaking of that unfolding, the textbook goes through this typical order of events.
Yes,
And the first thing that happens is a growth spurt.
that's right. So you might notice a girl
Okay.
kind of shooting up in height
Yeah.
before any other noticeable changes.
Okay.
It's kind of a sign that her body's really getting ready
Mm.
for those hormonal shifts
Okay.
that are driving the whole puberty process.
So growth spurt,
Yeah.
then breast development,
Mm-hmm.
pubic hair,
Yep.
peak height,
That's right.
and then finally menstruation starts.
Exactly. And I think it's important to note that
Right.
the timing of all of this can vary quite a bit from girl to girl,
Right.
which is totally normal.
Yeah.
Yeah.
So what kind of things influence when a girl starts puberty?
Well, genetics plays a huge role. So if a girl's mother or sisters started puberty early,
Mhm.
she's more likely to as well.
Okay.
But it's not just about family history.
Yeah.
Nutrition and overall health are super important too.
So you're saying that what a girl eats
Yes,
can actually impact when she starts puberty.
exactly.
Wow.
I had no idea.
Yeah. Girls who are well nourished tend to start puberty a little earlier
Uh-huh.
than those who aren't. And here's another interesting thing. Where a girl lives can also play a role. Studies have shown that girls in urban areas
Okay.
with good nutrition and access to health care, they tend to start puberty earlier
Wow.
than girls in rural areas.
Okay. That's fascinating.
Yeah.
Yeah.
And hold on, the textbook also mentions something about blind girls
Yes.
and early puberty.
Right.
What is that all about?
That is one of the more intriguing things that research has shown us.
Okay.
It seems that the absence of light exposure might actually play a role
Mm.
in the timing of puberty. Blind girls tend to experience menarche,
Which is the first...
the first menstrual period,
Yeah.
a little earlier than their sighted peers.
Okay.
And while we don't fully understand why that is,
Mhm.
it does point to this really complex interplay
Right.
of light, hormones, and the brain in regulating this whole process.
So let's talk about hormones.
Okay.
Because we all know they're really the masterminds behind this whole pubertal transformation.
Absolutely.
The textbook talks about
Yeah.
how levels of key hormones like gonadotropins
Okay.
and gonadal steroids
Mm-hmm.
are pretty low until around age 6 to 8.
Right.
Why is that?
Well, it's all thanks to this feedback loop in the brain and ovaries.
Okay.
And it's often called the gonadostat.
The gonadostat.
Yeah. So early on, the system is really sensitive to estrogen.
Okay.
And even small amounts tell the body to kind of hold back on producing more.
Right.
It's like this built-in brake system,
Okay.
keeping things in check until the time is right.
Basically, those tiny amounts of estrogen
Yeah,
are enough to keep the puberty train parked in the station.
exactly.
Okay.
For a while.
Okay.
But then as puberty starts to approach, that sensitivity to estrogen, it starts to decrease.
Okay.
It's kind of like gradually releasing the brake a little bit,
Okay.
allowing for the production of those key hormones that really kickstart the
Honestly.
process.
So as that sensitivity decreases, that triggers the release of GnRH, FSH, and LH.
You got it.
Did I say those right?
You did.
Okay, good.
Those hormones set off like this whole cascade of events,
Uh-huh.
ultimately leading to all those visible signs of puberty we were just talking about.
Okay.
Breast development, pubic hair, everything else.
It's amazing how it's all connected.
Right. It's amazing.
And speaking of hormones, I always thought that estrogen was like
Yeah.
the star of the show when it came to puberty.
Right.
But the textbook mentions a whole cast of characters thyroid hormones,
Okay.
adrenal androgens, and even leptin. What are they doing in this whole hormonal production?
It's definitely not a solo performance. It's
Right.
more like this complex symphony
Go ahead.
with each hormone playing its own unique role. So, for example, thyroid hormones. They're crucial for overall growth and development,
Okay.
and they also influence the timing of puberty.
So they're kind of like the stage managers, making sure everything is running smoothly.
I like that, yeah. They're the stage managers.
Okay. What about adrenal androgens?
Okay, so those are responsible for some of the changes that we typically associate with puberty,
Oh, yeah?
like the growth of pubic and underarm hair, and even changes in a girl's voice.
Wait, so those changes aren't all because of estrogen? I always assumed it was the estrogen show.
Right. That's what a lot of people think.
This is blowing my mind.
Yeah.
Okay, so what about leptin?
Okay, so leptin,
Is that connected to body fat?
it is. You're right. Leptin is produced by fat cells,
Okay.
and it actually has this really fascinating connection to puberty. It plays a role in regulating the release of GnRH and LH,
Okay.
those key hormones we talked about earlier. So think of it this way.
Okay.
Leptin acts like a messenger between body fat
Okay.
and the reproductive system.
So if a girl doesn't have enough body fat,
Uh-huh.
leptin levels might be lower, and that could delay puberty.
Exactly.
Oh, yeah.
Yeah, it's like the body's way of making sure
Yeah.
that there are enough energy reserves
Okay.
to support a healthy pregnancy.
Wow, this is all so intricate.
Yeah,
And there's even more, right?
there's more.
The textbook mentions this recently discovered hormone called kisspeptin.
Yes, kisspeptin is a relatively new player in the puberty game,
Okay.
but it seems to have a pretty important role. Research suggests that it acts as a key trigger for the entire puberty process. It actually stimulates the release of GnRH,
Okay.
which then sets off that whole cascade of
Right.
hormonal events.
So it's like the conductor of the puberty orchestra,
Yes.
giving the downbeat for everything to begin.
That is a great way to put it.
Okay.
And it's amazing how scientists are still uncovering these complexities and discovering new pieces of the puzzle all the time.
Okay, so we've covered the hormonal buildup.
Yes.
But what about the big event?
Yeah.
The moment everyone thinks of when they hear puberty menarche,
Okay.
the first period. It seems like this is kind of the grand finale,
Yes.
at least for this chapter of development.
It is a major milestone for sure.
Yeah.
The textbook describes menarche as a signal
Okay.
that this whole hypothalamic pituitary ovarian axis is functioning.
Oh my gosh. That's a mouthful.
It is a mouthful.
But that's basically saying...
It's a fancy way of saying
Okay.
that the communication between the brain, the pituitary gland, and the ovaries is working.
They're all talking to each other.
They're all talking to each other, exactly.
So it's not just about bleeding.
Right.
It's about this whole intricate hormonal symphony finally reaching its crescendo.
Exactly. And it typically happens between the ages of 10 and 16.
Yeah.
But as we've said, there's quite a bit of variation. But
Yeah.
here's the thing.
Okay.
Menarche doesn't necessarily mean that a girl is fully fertile.
What do you mean?
Well, it can take up to a couple of years after the first period
Okay.
for ovulation to become consistent.
Okay, so remind me.
Yeah.
What is ovulation again?
Yeah, so ovulation is the release of an egg from the ovary,
Right.
which is necessary for pregnancy.
Right.
So while menarche, that first period,
Yeah.
it marks the beginning of menstruation, it doesn't necessarily mean full reproductive maturity just yet.
So even though a girl might be getting her period,
Yeah.
she might not be able to get pregnant right away.
Exactly. And
Yeah.
that's something that I think a
Yeah.
lot of people don't realize.
Right.
It's an important distinction to make,
Yeah, definitely.
especially when we're talking to young girls about puberty and their changing bodies.
So what about when puberty doesn't follow the typical script? The chapter dives into precocious puberty and delayed puberty,
Okay.
which both sound a bit worrisome.
So while variations in pubertal timing are pretty common,
Okay.
it's true that in some cases puberty might start too early
Oh,
or too late.
okay.
So precocious puberty
Yeah.
is when a girl starts developing those secondary sexual characteristics
Okay.
before the age of 8
Okay.
or 7 in white girls,
Okay.
or if she starts menstruating before the age of 10.
So in those cases, puberty is hitting the fast forward button.
That's a good way to put it.
Okay.
And there are actually two main types of precocious puberty.
Okay.
The most common type is called constitutional precocious puberty.
Okay.
And it's basically just the body's natural timeline being a bit ahead of schedule.
So in those cases, it's not necessarily a cause for concern.
Not always,
Okay.
but it's still really important to see a doctor to rule out any other underlying conditions.
Okay.
The other type of precocious puberty is called GnRH independent precocious puberty.
Okay.
And this one can be a little bit more complex.
Okay.
It can be caused by things like ovarian or adrenal tumors that produce excess hormones, essentially mimicking the signals that trigger puberty.
That sounds serious.
It can be.
Okay.
Which is why a thorough evaluation is so essential.
Right.
Doctors will often order blood tests to check hormone levels, imaging studies like ultrasounds or MRIs, and sometimes even genetic testing to figure out what the underlying cause is.
So it's like a medical detective story, trying to figure out what's driving those early changes.
Exactly.
Okay. What about delayed puberty?
All right, so delayed puberty
Some of the signs.
is defined as the absence of breast development or pubic hair by age 13 or 14, or no menarche by age 16.
Okay, so it's not just about a late period.
Right.
It's about those earlier signs of puberty not appearing when they should.
Exactly. And like precocious puberty, there can be a lot of different underlying causes for delayed puberty as well.
Like what? What kind of things can cause puberty to hit the snooze button?
Well, it could be due to genetic conditions like Turner syndrome, which affects a girl's chromosomes. It could also be caused by problems with the hypothalamus or the pituitary gland, those master regulators of hormones in the brain.
Right.
Other possibilities include chronic illnesses, malnutrition, or even excessive exercise.
So it sounds like there's this whole spectrum of possibilities, from relatively benign to more serious underlying conditions.
Exactly. And depending on the cause, treatment might involve addressing that underlying condition, like treating hypothyroidism or providing hormone replacement therapy if the ovaries aren't functioning the way they should.
This is all incredibly fascinating.
It is.
But I have to admit, I'm feeling a bit overwhelmed by all this information.
Yeah, it's a lot.
It seems like puberty is this intricate dance of hormones, genetics, and environmental factors, all coming together to orchestrate this incredible transformation.
It is a complex process, but I think understanding how it works can really help us appreciate just how remarkable our bodies are.
Well said. And on that note, I think we need to take a short break to let all this information sink in. We'll be back in a moment to continue our deep dive into puberty. Stay tuned.
Sounds good.
Okay, so before we move on from the puberty basics, there's one more thing in this chapter I want to unpack.
Right.
It's about heavy periods, which doctors call puberty menorrhagia. Seems like, menstrual irregularities are pretty common in those first few years after a girl starts her period.
Right.
But the textbook says that excessive bleeding should always be checked out by a doctor.
It should.
Why is that?
Well, it's all about finding that balance between what's normal and what might be a sign that something else is going on.
Right.
So while some irregularity is totally expected, as the body is kind of adjusting to these new hormonal rhythms, heavy or prolonged bleeding, that could signal an underlying issue.
Okay. So how much bleeding is too much?
Well, it's definitely worth talking to a doctor. If a girl's soaking through pads or tampons every hour or two, or if her periods are lasting longer than a week,
got it.
Those are some signs that something might be off.
Okay. What are some of the things that can cause these super heavy periods during puberty?
So the most common culprit is something called dysfunctional uterine bleeding. Or DUB.
DUB. Okay.
And remember how we talked about ovulation?
Yeah.
Not always being regular in those first few years after menarche?
Right.
Well, without ovulation,
the
hormonal dance between estrogen and progesterone gets a little thrown off.
So it's like a hormonal miscommunication.
Exactly.
Yeah.
And that can lead to this overgrowth of the uterine lining. And when it sheds, it results in a heavier period than usual.
Okay. So DUB is the most common cause.
Right.
But the textbook also mentions other things, right?
It does.
Like problems with the thyroid, blood clotting issues, even pelvic tumors.
Exactly. It's really important to rule those more serious conditions out.
It seems like it's really important to,
Absolutely.
Okay, so what can doctors do to help manage these heavy periods?
That's a good question.
It seems like it would be pretty distressing.
It can be really tough, especially for a young girl who's already dealing with all the other changes of puberty.
Right.
So reassurance and support are super important.
Okay.
Doctors will also want to check for anemia, which can happen if a girl is losing a lot of blood.
Okay.
So iron supplements or even blood transfusions might be needed.
Wow.
To get her iron levels back up.
So it's not just about stopping the bleeding. It's about supporting the girl's overall health and well-being.
It really is about the whole picture. And in terms of controlling the bleeding itself, progestogens are often used. They're basically synthetic versions of progesterone. And they help to regulate the growth of the uterine lining and reduce bleeding.
I see. So they're kind of like putting a dimmer switch on those heavy periods.
That's a good way to think about it.
Are there other options if progestogens don't do the trick?
Yeah, sometimes doctors might use conjugated estrogens, especially if the bleeding is really heavy and needs to be stopped quickly. But estrogens are usually just a short-term solution, and they need to be carefully monitored.
Got it. So it seems like managing heavy periods, it involves a little bit of trial and error.
It does.
To find what works best for each girl.
Yeah, individualized approach. And in some cases, further investigation might be needed.
Like what? What kind of investigation?
So a doctor might recommend a pelvic ultrasound to rule out any structural abnormalities in the uterus or ovaries. And in some cases, a uterine curettage might be done. That's a procedure where a small sample of the uterine lining is taken for examination.
So it's not always a quick fix.
No.
Sometimes it takes a little more detective work.
Right.
Okay. Going back to precocious puberty for a second. I'm curious about those GnRH agonists we talked about earlier. You mentioned that they're used to suppress puberty in girls who are developing too early. Are they ever used for anything else?
That's a great question.
I was just curious.
Yeah, so while they're commonly used for precocious puberty, GnRH agonists actually have a variety of applications. In reproductive medicine, they can also be used to treat things like endometriosis, fibroids, and even some types of infertility.
Wow, so they're pretty versatile.
Yeah, they are.
So how do they work?
How do they work?
For those other conditions?
Well, it all boils down to their ability to suppress the production of certain hormones, like estrogen and progesterone. So by lowering those hormone levels, GnRH agonists can actually help to shrink fibroids and endometrial implants, which can cause pain and other troublesome symptoms.
So it's like hitting the pause button on those hormone-driven conditions.
Yeah, that's a good way to put it. It gives the body a chance to kind of reset and hopefully alleviate some of those symptoms.
Fascinating. Now, switching gears to delayed puberty. I remember the textbook mentioning Turner syndrome as a potential cause. Can you remind me what that is?
Of course. So Turner syndrome is a genetic condition that affects only females. And it happens when one of the two X chromosomes is missing or partially missing.
So it's a chromosomal issue. But how does that lead to delayed puberty?
Well, that X chromosome carries genes that are really crucial for ovarian development and function. So in girls with Turner syndrome, the ovaries may not develop properly, or they might not function as well as they should.
And that leads to lower levels of estrogen.
Exactly.
Which we know is essential for puberty to get going.
It's like a missing piece of the puzzle. And besides delayed puberty, girls with Turner syndrome often have other characteristic features as well.
Like what? What are some of the signs?
Well, they tend to be shorter than average. And they might have a webbed neck or a broad chest. Sometimes there are heart defects, kidney problems, or even learning disabilities.
Wow. So it can affect many different parts of the body.
It can. It's a complex condition that requires a team approach to management. You know, doctors, geneticists, other specialists, all working together to address the different challenges.
Let's talk about another potential cause of delayed puberty. Hypothalamic pituitary dysfunction. That sounds pretty intimidating. What exactly does that mean?
It sounds complicated.
It does.
But it basically means that there's a problem with the communication system between the brain and the ovaries. Remember the hypothalamus and the pituitary gland?
Yes.
They're like the command center for hormones in the body.
Right. They release those key hormones that tell the ovaries to start producing estrogen.
Exactly. So if there's any dysfunction in either the hypothalamus or the pituitary gland, it can really disrupt that whole chain of command.
Right.
The signals don't get through.
Yeah.
And puberty doesn't start on time.
So it's like a broken telephone line between the brain and the ovaries.
That's a great way to put it.
Okay. And there are a lot of things that can cause this type of dysfunction, right?
There are. It could be genetic mutations, tumors, infections, or even head trauma.
Okay.
And sometimes doctors just can't pinpoint the cause at all.
Okay.
It remains a bit of a mystery.
Another one of those medical mysteries.
Right.
Okay. What about treatment?
Treatment.
Can anything be done to kind of jumpstart puberty in these cases?
Well, it really depends on what the underlying cause is.
Okay.
If it's a treatable condition, like a tumor that can be removed, addressing that will often get things back on track.
Okay.
But sometimes hormone replacement therapy is needed.
So that's where doctors give synthetic versions of those missing hormones.
Exactly. To kind of kickstart the process.
Okay.
Yeah.
So we've been talking a lot about the biology of puberty, but I know it's not just about hormones and physical changes.
Exactly.
There's this whole emotional and social side to it as well.
Absolutely.
The textbook touches on this briefly,
Yeah.
mentioning the importance of counseling and support.
For girls experiencing precocious puberty.
Right.
Why is that so important?
Well, just imagine being a 7-year-old girl who suddenly starts developing breasts and pubic hair.
Yeah.
It can be incredibly confusing and isolating, especially when her friends are still playing with dolls and haven't even begun to think about those things.
Right. It must feel like her body is betraying her in some way.
It can.
Developing way faster than her emotional maturity.
That's a good way to put it.
Yeah.
And it can really impact a girl's self-esteem and her social interactions.
Right.
She might feel embarrassed or ashamed of her body, withdraw from social activities, or even become a target of teasing or bullying.
That's heartbreaking.
It's tough.
Yeah. So it sounds like counseling can be a real lifeline for these girls.
Absolutely. Counseling provides that safe space for them to express their feelings, learn about what's happening to their bodies, and develop coping mechanisms. Yeah. And it's not just about individual therapy.
No.
It seems like family therapy could be really beneficial too.
You're right. Parents often struggle to understand and support their daughters through precocious puberty.
Yeah.
So family therapy can help everyone communicate more openly and figure out how to navigate this together.
Yeah, as a team.
As a team, exactly.
So it's all about open communication, understanding, and support for both the girl herself and her family.
Exactly.
Now, on the flip side, we have delayed puberty.
Right.
While it might not seem as emotionally charged as precocious puberty, it can still have a big impact.
It can.
On a girl's emotional well-being.
Right.
I remember feeling left out.
Yeah.
When all my friends were developing and I wasn't.
Oh.
It must be really tough.
It can be.
For girls going through delayed puberty. To kind of watch their friends hit these milestones while they're still waiting.
Absolutely. They might feel like they're lagging behind their peers. And it can lead to feelings of self-consciousness, anxiety, and even depression.
And to make things even more complicated, that delay might be a sign of an underlying medical condition.
Exactly.
Which must add another layer of stress and worry.
Absolutely. So it's really important for doctors to not just focus on the medical management, but to also address those emotional and social aspects as well.
It's about treating the whole person.
Yeah.
Not just the condition.
Exactly.
Now, we've been focusing on puberty in girls. But I'm curious about how things differ in boys.
Okay.
The textbook mentions that precocious puberty is more common in girls.
Right.
But delayed puberty is more common in boys. Any idea why that is?
That is a fascinating question.
Right. It seems kind of counterintuitive.
Yeah, so the exact reasons for these gender differences aren't fully understood.
Okay.
But there are a few theories. Okay, so one possibility is that the criteria for diagnosing delayed puberty in boys might be too strict.
Okay.
So doctors look for testicular enlargement by age 14 as a sign that puberty is underway.
Right.
And some experts believe that cutoff age might be a bit too early.
Okay.
Leading to sort of an overdiagnosis of delayed puberty.
So some boys who are diagnosed with delayed puberty might just be developing on a slightly slower timeline.
Exactly.
Okay.
It's also important to remember that the hormonal pathways involved in puberty are slightly different in boys and girls.
It's not just about estrogen and testosterone.
It's not just about those two.
Right.
There are other hormonal players involved, and those differences might contribute to the different patterns we see of precocious and delayed puberty.
Okay. It seems like there's still a lot we don't know.
Right.
About the nuances of puberty.
There is.
And how it differs between the sexes.
It's a complex process, and there's always more to learn.
Well said. And as we wrap up, I think the key takeaway here is that puberty isn't just a straightforward biological event.
Right.
It's this intricate interplay
of
hormones, genes, and environmental factors.
Yeah.
And it has these profound implications for both physical and emotional health.
Absolutely.
I'm feeling a bit overwhelmed by all this information.
Yeah, it's a lot to take in.
But also incredibly fascinated.
It is fascinating.
By the complexity of this whole process.
Yeah.
Thank you so much for guiding us through this deep dive into puberty.
My pleasure.
I feel like I've learned so much already.
Good.
We'll be back in a moment.
Okay.
For our final thoughts on this fascinating topic.
Sounds good.
Stay tuned. This deep dive into puberty has been quite the journey.
It really is a fascinating topic.
Yeah, and I feel like we've only just scratched the surface.
Yeah.
But as we wrap up, it's important to remember that it's not just a biological event.
It's not just biology.
Right.
It's a huge transition that really shapes a girl's physical and emotional well-being.
Exactly. And, you know, we've talked a lot about the immediate impacts of puberty.
Right.
But the textbook got me thinking about the long-term implications.
Okay.
Like, are there things that happen during puberty that might have lasting effects on a girl's health?
Yeah, that's a great question. And it's one that researchers are still actively investigating.
Okay.
You know, there's growing evidence to suggest that the timing of puberty, whether it's early or late, can have significant consequences for a woman's health throughout her life.
So you're saying that when a girl goes through puberty, might actually influence her risk for certain health problems later on.
Exactly.
Wow.
Studies have shown, for instance, that early puberty is associated with an increased risk of certain health issues.
Okay.
Later in life.
Like what?
Like breast cancer, heart disease.
Okay.
And even obesity.
That's concerning.
Yeah, it can be.
So do we know why early puberty might have these long-term effects?
So the exact mechanisms aren't fully understood.
Okay.
But it is thought that prolonged exposure to estrogen might play a role.
Okay.
You know, a girl who starts puberty early is essentially exposed to those hormones for a longer period of time over her lifespan.
Right. So it's like a cumulative effect over time.
Right.
Okay. What about late puberty?
Okay, so late puberty.
Does that have any long-term implications?
Interestingly, late puberty has been linked to a lower risk of some of those same health problems, potentially because of a shorter overall exposure to estrogen. However, late puberty can also have its own set of challenges, particularly in terms of bone health.
Right, because we know estrogen is important.
Exactly.
Strong bones.
So a delayed onset of puberty can lead to lower peak bone mass, which might increase the risk of osteoporosis and fractures later in life.
It's like this delicate balancing act.
Yeah.
Early puberty might increase the risk of certain diseases.
Right.
Late puberty might impact bone health. It seems like there's no perfect timing.
Yeah.
And every girl's experience is unique.
You got it. Every girl is different. And that's why it's so important for healthcare providers to really consider each individual's unique circumstances.
Right.
Their medical history, their family history.
Right.
When they're making decisions about puberty and its management.
This deep dive has really opened my eyes.
Yeah, me too.
To the complexity of puberty.
It is complex.
And all its, you know, far-reaching impacts.
Yeah. And we're still learning so much.
Right. It's not just a biological event.
It's not.
It's really this pivotal chapter in a girl's life story.
Yes.
And it seems like we're still learning so much about how it all works.
It's a fascinating and constantly evolving area of research.
I want to thank you for joining me on this deep dive into puberty.
It's been my pleasure.
I feel like I've learned so much, and I hope our listeners have too.
I hope so too.
And to our listeners, If this deep dive sparked your curiosity, we encourage you to explore further.
Yes.
Talk to your doctor, do some research, and don't be afraid to ask questions.
That's right.
The more we understand about puberty, the better equipped we'll be to support girls as they kind of blossom
Absolutely.
into the strong, confident young women they're meant to be.
Knowledge is power.
Thanks for joining us, and until next time, keep diving deep.